What is cerebral arteriovenous malformation? A cerebral arteriovenous malformation is an abnormal anastomosis, connection, between the arteries and veins in the brain. It is due to the lack of a capillary bed and are most commonly of prenatal origin. The picture shows a large arteriovenous malformation of the parietal lobe. The most frequently observed problems related to a cerebral arteriovenous malformation are headaches and seizures, cranial nerve afflictions including pinched nerve and palsy, backaches, neck aches, and nausea. Perhaps 15% of the population at detection are asymptomatic. Other common symptoms are a pulsing noise in the head, progressive weakness, numbness and vision changes, as well as debilitating, excruciating pain. The overall annual incidence of hemorrhage from a ruptured arteriovenous malformation is 2 to 4%. Smaller arteriovenous malformations have a greater propensity for hemorrhaging, whereas larger arteriovenous malformations tend to more often cause seizures instead. A 17-year-old right-handed boy is brought to the emergency department due to brief loss of consciousness after colliding with another player during a football game. The patient reports fogginess, but has had no headache, vomiting, focal weakness, or numbness, or seizures. He has no other medical conditions and takes no medications. Vital signs are within normal limits. On physical examination, the patient demonstrates retrograde amnesia about the game, but no focal neurologic deficits. CT angiography of the head reveals no skull fractures or intracranial bleeding, but a small lesion in the left temporal region composed of abnormal vascular channels is noted and is shown in the exhibit. Without treatment of this abnormality, which of the following will most likely occur in this patient? The correct answer is D, spontaneous hemorrhage. This young patient most likely sustained a concussion because he lost consciousness and has retrograde amnesia. Imaging is performed to evaluate for intracranial hemorrhage. Incidentally, the CT angiogram reveals a cluster of dilated vessels, that is, bag of worms, in the left temporoparietal region with large arterial feeder vessels. This is consistent with an arteriovenous malformation. Arteriovenous malformations occur when an artery directly anastomoses with veins without an interposed capillary bed. The resulting high-pressure blood flow through weak vessels, that is, veins, predisposes patients to aneurysm formation and/or spontaneous hemorrhage. Seizures also commonly develop and may be due to local accumulation of hemosiderin, a cortical irritant, from microbleeds. Most arteriovenous malformations are congenital and sporadic. They can occasionally occur as a component of hereditary hemorrhagic telangiectasia, that is, Osler-Weber-Rendu syndrome, an autosomal dominant disorder associated with mucocutaneous telangiectasias, for example, nasal mucosa, intestinal mucosa, and multi-organ arteriovenous malformations, for example, lungs, liver, and brain. Choice A. The pulmonary capillaries filter potential debris from the venous blood, for example, clots, bacteria, preventing it from entering the systemic circulation. A pulmonary arteriovenous malformation, but not a cerebral arteriovenous malformation, bypasses this filtering system, leading to paradoxic embolization into the systemic arteries, for example, stroke or brain abscess. Choice B. Flaccid paralysis can occur with lesions that affect the peripheral nervous system. However, lesions in the central nervous system lead to upper motor neuron signs, for example, spastic paralysis, hyperreflexia. In addition, cerebral arteriovenous malformations very rarely lead to motor deficits. Choice C. Arteriovenous malformations are congenital malformations rather than neoplastic proliferations. Therefore, they are not at risk of malignant transformation. Choice E. Although some cerebral arteriovenous malformations are stable and do not lead to either seizures or intracerebral hemorrhage, they never resolve spontaneously. Educational objective. Arteriovenous malformations occur when an artery directly anastomoses with veins without an interposed capillary bed. They may result in spontaneous intracerebral hemorrhage or seizures, or they may be discovered incidentally when brain imaging is obtained for another reason.